Boss Mom, where I talk about being an NP, an entrepreneur, a mom, a wife, and everything in between. So today I decided to talk to y'all about how I became an FNP, and also I am in the DNP program, which is Doctorate of Nursing Practice. And I wanted to talk about why I decided to be a DNP, why others decided to be a DNP. I've been seeing a lot of questions on Facebook. I'm in a lot of groups, and about, do I need to become an NP? Why do I need to do a DNP? Why would I spend this money? So also I've been seeing questions about FNP, like should I spend that time and money go back to be FNP? A lot of people are, since the COVID, they're trying to find other things to do besides bedside. They just don't want to be at the bedside anymore. One of the reasons I decided to go back to school to be an FNP is I was at the bedside for a while, probably about a good 10 or so years, 13 maybe years at the bedside. I don't remember, but it was a while at the bedside. And I was finding that I was getting bored with my job. I was lackluster for me, and what the love and joy. I still like my job, but it just was like going to work. So it was no more. I didn't feel like it was a lot more to learn, or I just didn't want to go into those extra positions of like, I didn't want to be a charge nurse. I didn't want to be a director. I didn't want to be in management in the hospital in that setting as a RN. So that being the case, I decided to go back by FNP. So the story started, I had a friend. She was my coworker, my friend, and now one of my mentors. She kept talking to me because I was like, I just want to do something. I don't know what I want to do, but I know want to do something else. I've been doing this for a while, and after you find yourself like, I want to say, treating your patients like a job, like you going through the motions. You're not, the ultimate caring is not there. It's time to move on. As a nurse, that's why we get into it. It's for caring and to be there for our patients. And I just was going through the motions. Like, I always was nice and caring to my patients, of course, but the feeling behind it was was turning gray. Like I got home today. It wasn't there. I was just really bored with it. So and I had different jobs in nursing. I had done a travel assignment. I had worked in the pediatrics. I had worked in the ICU. My main specialty was NICU, NICU, neonatal intensive care unit. That was my main specialty. I worked there throughout my nursing career. I started in the neonatal intensive care unit. So, which was very rewarding for the most part, but I I was just bored. I just got bored. So, and a lot of people said, well, try something else in nursing. And I did. And I was just tired of the bedside. Management was changing to be more, which I feel like customer service is good. It's great. You need to have great customer service, but they were not supporting their nurses. And everything was about getting customer satisfaction scores and not about how working as a nurse, not supporting your nurses. So if something happened, it was always the nurse's fault. Even if it wasn't, it was just like, if a patient came and said such and such did such and such, and they knew that the patient was wrong, it was like reprimand. So that environment got tiring. I worked in another environment, another hospital, where they did value their nurses. We did feel appreciated, and therefore we were excited about coming to work and excited about our patients, and we were included. And I just think that's a better model. when you support your nurses and you treat them good, it reflects in their work. So when you go to somewhere else that's, got a man-eating spirit, it's just time to go. So that's basically what happened. Back to my mentor. So she was like, well, go back to school. I'm going to school for FNP. Why don't you do that? Family Nurse Practitioner. That's what FNP stands for. And I was like, well, I worked in a pediatric office and I don't want to be a pediatric. I don't want to do that. She's like, well, it's a different role. And that's one thing I want y'all to understand. It's a different role. It's a total different career. Yes, we have nurse in our name, but we are no longer acting in that role, in a registered nurse role. A registered nurse takes orders from doctors. A registered nurse, we do what the doctor said to do. Even though we know a lot and we learn a lot to where we know what the doctor might say to do, ultimately our goal is to follow orders. And I learned that from my first clinical, that we are now taking on a different role, to where we're now giving the orders and we're making the treatment plan, and that nursing care plan is going out, like rule out such and such. It's just a different model. So my friend and mentor explained that. She's like, you're not going to be in the same position. You're not going to be, in there giving shots and, getting ugly looks from the parents. And it's just a different role. You're basically going to go in, see the patient, talk to them, order some medications or order whatever they need, and you're out of there. You're not going to be the one that has to fight and struggle with the patient and the parent looking at you like, what are you doing with my baby? When, they brought them in for the immunizations. So this was a pediatric position. And I worked with adults too. I worked with adults in ICU, where, again, you get a different level of respect between being a registered nurse at the bedside and a family nurse practitioner. Nurses are respected for being caregivers and being the one at the bedside. So people and their families, they always say, oh my gosh, you're a nurse, you're the best, y'all are needed. But it's a different level of respect. So when you become a family nurse practitioner and you're doing the order, it's like now you're working like a physician. So again, that you're being addressed as the person who is in charge of that patient care. So that might be a motivation. It's just a different role. You're just learning something totally new, which was very attractive to me at the time because I was bored, like I said. So after my mentor and friend and colleague told me about the role change, I was like, well, okay. So I still wasn't sure when I got in the program, is this what I want to do? I just started doing it. And as time went on, I like learning. I love education. I like adding on to education. I feel like education is always a good investment, to whether you're, going back to school for your second, third, or fourth degrees. I have some degrees. So I went back to school, as I said, and I went to Chamberlain College of Nursing. I love the program. A lot of people say, oh, you went to an online degree, it wasn't as good, you're not getting a great education. They're just passing out, they're just handing out degrees for money, and that's not true. We had to put the work in, and a lot of times I feel like the online colleges, to try to make up for that stigma, gives you more work to do on your own, and you have to find a way to do it because you don't have that support of the big brick and mortar. You don't have that support of knowing who your teacher is and seeing them every day. But I find myself a self-learner. I've always been that way, where I don't do well in classes. I don't have the attention span. So, we'll talk about more about my attention span later, maybe. But I just do better online. So I did do well online, and I went to Chamberlain College of Nursing. I am not sponsored. That's not a sponsored plug for them. It's just where I went and I enjoyed going there. So when I got to clinicals, I still wasn't sure is this what I wanted to do because it was scary. It was a different role. Now I need to know all the processes of the body and what makes it tick and why is it happening and how do I treat it and the different diagnoses, and I just wasn't sure that was for me. And my first rotation was like primary care. And I was like, I don't really like this. And it might have been just my environment at the time. So I went on, I did primary care, I did geriatrics, I did women's health rotation and another like general rotation. So as the process went on, I started finding things I like to do. Well, never did I take a peds rotation because at the time, Chamberlain wasn't making us take peds. They were like, if you get enough peds patients in your family practice rotation, you don't have to do peds. So I didn't want to do peds. I had worked in a peds hospital. A peds practice, and I just did not want to do peds because as a RN, I did that and I just found that I didn't like it. In the practice I work in, they used RNs basically as paper pushers and administrators, and we filled in for the LPNs, licensed practical nurses, because they were the main people that were providing care for the patient. And then the RNs were like the messengers to the physicians and doing a lot of paperwork and, doing immunizations, inventory, and stuff like that. So I am a hands-on. I love people, and that just was not a good role for me. So it left a bad taste in my mouth for pediatrics. So I didn't want to do pediatrics. I didn't even want to do a rotation in peds. It's funny because that's what I ended up doing. But I did get a lot of peds patients in my rotations. I got enough. And finally in one of my last rotations, I liked women's health, but I knew I would get bored with it because it was just so specialized. Like my last position as being a neonatal nurse practitioner, neonatal nurse. It was so specialized that I didn't want to get bored with it. But I worked for another practitioner, and it was just very beneficial because she was just like, go and learn and do and show me what you got. So she puts you out there and you just do. You are the practitioner. And she's like, well, you bring her back and tell her what you saw, and you did, and she taught me how to do. She really let me grow and spread my wings, and that she let me touch the patients. Because a lot of times you go in these and they like, just stand back and watch. Don't touch my patients because they don't want a student touching them. So I was able to learn in that way. And as time went on, I still was like learning and growing, and like, do I like this? This is what I want to do. And I think more it was fear because of the change of the role. So I graduated and with honors. And I did better than I ever did in college before because I just was focused. And truthfully, the FNP degree was easier than getting my registered nurse, my BSN degree. It was, I had more knowledge under my belt. I had years of experience. So it just was an easier degree. And I really enjoyed the program and learning and everything. So I got out and I was in the job market. And like I said in one of my other videos, my main goal was to get a job. Not to pick a specialty, not to, be picky. The first year my plan was to get a job in anything that was paying me decently and to work that job, get the experience, and then go on something that I had to get a job. So and I thought that's what I focused on. Then after getting the job in a pediatric practice, I enjoyed it. I fell in love with it. I was like, oh my God, this is where I was supposed to be after the first 2 weeks. First 2 weeks, I was sick as a dog. Just sick, probably more than the first 2 weeks, probably the first 2 months. I was really sick because when you start working in peds, your immune system has to build up to all these little PD bugs that they have. So other than being sick constantly, I loved it. I love my patients. I love the interaction I got with their parents. I love the level of respect. And I think every level of different experiences and education I got, when you get the respect that you feel like you've been educated for, it just makes you just have a lot of pride in what you do. So when you go in that room and they're happy to see you, or they're not happy to see you, and then they leave happy, it's just a feeling of accomplishment and joy that you get. And one thing I love about peds patients is they rarely lie to you. Like, they don't come in here and blowing up big, oh my gosh, this is going on with me, and yada yada yada, and you came in for pink eye, but now you're telling me about a bunion. Doesn't happen in peds. Pediatric patients, you say, my tummy hurts, and then you treat them for whatever they came in for, whether it's a tummy ache or a pink eye or whatever, and then that's it. They're gone. The parents might say, oh, didn't your tummy hurt last night? Or didn't you do this last night? And they're like, no, my tummy hurt. That's it. Or they might, that's what I'm saying, is they might add on something. Or didn't your toe hurt? And your stomach hurt? And they're like, just my tummy. So they are when they start talking, they're pretty good historians of what's going on with them. The teenagers are a little harder, though. They are quiet, and you have to kind of like dig it out of them, or look at their parent like, so what's going on? Like, why are y'all here? But when you see a patient a lot, you start to get to know them. They get when you build their trust, they start to talk to you, and sometimes coming on their own. I'm like, I just want to talk to Miss Tamu. And first time I really enjoyed my name. Like, I've had to grow into it. My name is Tamu Sproul Barton. So my name was Tamu Sproul before I got married. And I know this is off subject, but growing up in America, and I'm American, my parents are American, it just was different. It was just like, people like, I didn't even go by Tamu, really. I went by my nickname. I'm not going into the nickname, but I went by my nickname most of my life. And then with a name like Tamu, it rhymes with Shamu and Moo Moo and all the moves. So anyway, I love my name. It means sweet in Swahili. So, and the kids are like, hey, Miss Moo. Hey, Miss Tamu. Miss, it's really cute when kids do it, when you're an adult. So, it's really a great, I just love working with kids. And I did start working for the adults also. The practice I was working, she wanted to turn it into a family practice. So I saw about 90% children and 10% adults. And now in my own practice, I see, like half and half. But you have to make a decision on why you want to become a FNP. It's a personal choice, whichever way you want your career to go, but I do not regret it. I would definitely do it again. Any chance to advance your career and get more education and knowledge is a great choice. There are different programs, different ways to do the program and get your advanced degrees. Going from BSN to DNP, you can just do it in one fell swoop, and you decrease the time of having to do the degree, to do the separate degrees, because if you do it separately, it's like BSN to MSN is 2 years, and MSN to DNP is 2 years. I chose to do it that way, and the reason why I chose to do it that way is because I wanted to go ahead and finish it and get out and work as an FNP. And then when I was ready to go back and then do my DNP. So I like to split it up, because a lot of times when you're in the BSN to DNP program, you cannot work as an FNP until you finish the whole program. And that's not what I wanted to do. But again, you do shorten your time doing it that way. You do it within 3 years instead of 4. So those are all good options. And I'm glad I could present this content. So if you enjoyed it, please like, subscribe, and ring that notification bell so you can see more content like this and you can know when I'm posting content. Have a great day and God bless.